that this is something that everybody needs to take into consideration. What are your ideas about that?
I love the fact that the conversation is starting to move into a humanistic platform, because if we're breathing, we fall somewhere on this mental health spectrum. We're all on there. And the more we're able to humanize ourselves on that spectrum, the more we're able to provide the grace and humanize somebody else on that spectrum as well. So I think now we're starting to realize that there's not anything necessarily wrong with me. There's not anything necessarily wrong with my children or my family. It's the fact that some of us are in situations, or there's societal issues, or there's other things at play in our environments and around us that contribute to what we're experiencing. And by giving life to that, by being able to speak to that, I think it kind of frees people up from feeling the guilt or the shame or whatever else it is of struggling with what they're struggling with. And I mean, I'm not gonna lie, I think hip hop played a big part of that.
Okay.
I think hip hop's played a big part. When you look at the number of artists that came out in the past few years, and start talking about their mental health, start talking about they're going to inpatient to work some stuff out, to talk about, it's changing the game. I mean, when you look at Kendrick, or you look at blocking on his name, Kid Cudi, there's so many of them that are speaking about this. It's starting to become part of the normal conversation that we're having. And I think a lot of that,
God speaks to this a lot within the Breakfast Club.
Yeah, Charlemagne the God speaks to it a lot. And I think the more we can make it tangible, I think one of the reasons why we didn't talk about it before, one was faith, and now faith in the church is being married to mental health in ways we haven't seen before. But then two, we're also making it tangible. It's not just depression, it's not just anxiety, it's not just bipolar, but we also start talking about functionality. What does that mean in terms of how I function? And that's something I can identify with more than just some concept floating in the air.
I think I know we're starting at a younger age, trying to discuss mental health, and we're talking about mindfulness more in schools, and the big wave now is social emotional learning. So all of those things are starting at the elementary level and moving up. So it's so many different traumas that can happen in your life that can lead to some form of mental health, just as having an absent parent, or having a parent who's addicted to some kind of substance. Just some things that are more common, and they haven't been factors concerning this is what's leading to these issues, but they do play a role. But like I said, we're talking about it more on the starting with the elementary level, and I think that's going to make a big difference in the future, since we're starting at a younger age and we're trying to provide tools for kids to be able to deal with these different issues. So.
To that point, I think that's a great point, because I think it's a lot of the younger generations that are more open to having the discussion. So what we still see is this generational divide when you get younger students or young adults who are like, yo, I'm ready to talk about my mental health. I'm ready to talk about these factors. But they still have parents who are like, hold on now, don't blame me for how you're operating now. Don't bring that to me. So there's still this managing between generations. Even though we're moving there, I know we have a lot more space to go. But then also looking at that generational divide where we're bringing up more students, more young people who are ready, willing to engage in the conversation, but they're still interacting with older family members who are still kind of pushing away to a large degree with the conversation.
Awesome. And when you say mental health, you have that negative, stigma attached to it, but it's just, how are you doing mentally? How are you feeling? So we all have, mental health is something that we all deal with. Doesn't mean that's a negative thing, but we have that stigma and we need to work on changing it.
And really how someone displays the symptoms really changes the way we conceptualize what they have. There's a lot of cases where you get top level CEOs who are workaholics, who work hard, who struggle with something like bipolar, but during their mania, they have the resources to tunnel it in one work, and they get pat on the back, they get praised, they get awarded. But then you might have somebody in the hood, same mania, not the same resources, and now they're wearing a pair of cuffs, or their behavior is being conceptualized in a certain way that the other person is not being. So a lot of times our behaviors are conceptualized based on the bodies they emanate from.